identified in this document and through guidance from our partners at CHCC. With that said, please let's give a warm welcome to our facilitators for today.
Thank you. Buenas, Afade. Hello, my name is BJ Nicholas. As mentioned, I am the Public Health Emergency Preparedness as well as Hospital Preparedness Coordinator for CHCC. I'm joined today with Ms. Doris Cruz, who is also our Data and Surveillance Coordinator, who monitors a lot of the information we gather regarding infectious disease and provides a lot of the epidemiological reports out on a weekly basis to a lot of our stakeholders and partners that are interested in the information. I wanted to thank NMC for having us here today. Very grateful that we can provide this opportunity for everyone in attendance online as well as those in the room to better understand and determine what would be the best methods of protection, mitigation, and preparedness, steps that we can make to better prepare ourselves in the event that we do have a COVID-19 case that presents here in the CNMI. So if it would be possible, sir, could I get the presentation up and going? You want to go ahead and go?
How do you skip I need to share.
Thank you, IT. Go for it. Okay, talking about the novel coronavirus, what we want people to know is that this is not the first genetically mutated virus that has presented itself in the world. Other areas that are other viruses that have been present in the more recent has been the 1918 pandemic influenza virus, also known as the Spanish flu, which ravaged the world, causing about 50 to about 100 million deaths, more than World War I and World War II combined. So the United States, other countries, through Asia, through Europe, we have seen this before. In a different method now, a different genetically mutated virus, but it is in a very similar fashion, something very new to us here globally. And that's where the novel comes into it, is that it is a new virus, shares a lot of genetic traits with our MERS, with our SARS from previous years. However, we are still, as the days and weeks go on, continuing to better understand how we can approach this virus, what methods we can employ to better provide relief and comfort to those who have been confirmed, and determining what future steps we can take globally to ensure that we can mitigate a lot of the other issues, economics and whatnot, involved in being able to respond to a virus of this magnitude. Wanted to bring this picture to everyone's attention, and a lot of people asked about this picture in particular. I wanted to show you what we call today as an alternative care site. In 1918, if I'm not mistaken, this picture was taken out in New York City. We had a lot of people during 1918 who were testing positive, coming in with flu-like symptoms into hospitals spread throughout New York City. And knowing that their hospital could not be able to provide the level of care seen from this medical surge, determined that it would be a good opportunity for them to be able to identify a warehouse or an open setting that they could be able to build up with medical equipment and better prepare themselves to be able to take in additional patients as needed. This, as I understand it right now, is an alternative care site from that time. And here in the CNMI, we do have a very similar setting that we are looking to employ should an individual arrive in the CNMI and present with symptoms of concern regarding the COVID-19. Wanted to share some of the information with you that we captured from this morning. A lot of this is shared with us through Johns Hopkins University. Their IT department did provide together with a website where we can be able to link onto and get almost hourly, bi-hourly updates regarding a lot happening with the novel coronavirus. Some of you may be aware of this, others may not be as aware, but we can definitely share this information with you guys so that you can track as well and see where we're seeing a lot of the numbers coming in from. If you could notice, the total confirmed as of 9:13 this morning was 92,818. Of those, a majority of those cases remain in China. However, we have been seeing a huge uptick in other areas, in particular South Korea, Italy, Iran, and also seeing additional cases in Japan. One of the reasons why this is of concern for us, particularly in the CNMI, is because of the huge economic constraints that we currently have in play. We have right now, based on the discretion of the State Department, lost the China market specifically to allow them to be able to maintain a lot of the virus concerns within their region. Right now, we still do receive South Koreans as well as Japanese tourists coming into the CNMI. And as we understand it, there are negotiations, discussions in place right now to determine whether at some point it may be safer for United States, the states as well as territories, to make that recommendation that we should start looking at canceling flights. Although we are not, we are not looking at it from an economic standpoint, we are looking at it from a health standpoint. We understand that this is we are all entwined together in this. Knowing that we are seeing an uptick of cases in South Korea does provide for concern for us here in our community. But we want to ensure everyone that we are maintaining a lot of situational awareness regarding this effort, and we will be providing information through the coordinated task force that has been developed by the governor in coordination with Port Authority, CNMI Customs, and some of our other frontline agencies, including Homeland Security and Emergency Management. Another area that I'd like to touch on in particular is the total deaths that you see associated with the COVID-19. Right now it stands at 3,160, with the majority of those deaths occurring in mainland China. And as of right now, to date, we have about six individuals in the United States that have succumbed to the disease, particularly in the Seattle, Northwest Pacific region. We also have 28 deaths right now in Korea, which is of concern. And when I get further into the presentation, I will provide some of the data that kind of supports a lot of our findings, a lot of what has been found in the world globally by a lot of experts. And I'll be able to better allow you to be able to take this information and make the necessary conclusions and engage us if needed. Again, I just want to make sure I did mention it if I haven't already. If you have any questions or anything pertaining to the novel coronavirus or any of the efforts that we've employed in the CNMI from CHCC, we can always discuss this. You can always reach out to us at Public Health Emergency Preparedness. You can always reach us also at the hospital in general, and we can provide a lot more information and guidance. At the end of the presentation, if I don't have the answer for you, what I can promise you is that I will be engaging proper individuals, subject matter experts, to make sure that I can provide you with the necessary response and get you that information in a timely fashion. Another area that I just wanted to touch on regarding a lot of what we're seeing with the COVID-19 is the total recovered. If you notice the 48,226, these are people that have been determined to no longer harbor the virus. They have totally recovered. They are no longer a threat to the people around them. As we understand it, this number is continuing to increase very much on a regular basis. And our hope is that when I get into some of the charts, we'll be able to better identify and determine some of the stuff that can be employed that will assist us in a lot of the efforts moving forward. We're definitely looking at the data, making sure that we do make informed decisions based on this data. And if anything arises outside of what we have seen and what we have engaged with both CDC and the World Health Organization, WHO, that we do keep them apprised, and that we also engage their subject matter experts to give us the necessary guidance as possible. Some of the information I wanted to share is in particular to this graph. If you can see, it might be hard for you to look at. The orange line is people in China in particular. The green line are people that have totally recovered. And then the yellow line are people who have been confirmed with the infection outside of China. If you notice, there was a huge jump there. And I wanted to speak specifically about that jump so that people can understand what happened in terms of the data we were receiving. At the time of that jump, China was running out of tests. And in order for them to be able to make sure that they still get the necessary information out and that they're able to better monitor a lot of their communities, they changed the case definition to allow for them to be able to determine novel coronavirus through CT scans. And what I mean by this is that they'll take an X-ray of your lungs, they'll look within your lungs to determine whether you have what's called ground glass. And then from there, in addition to other comorbidities, whether you have other underlying health conditions or whether you present with other symptoms, a doctor would be making that determination of whether or not to diagnose you with COVID-19. The WHO, immediately after understanding this from China, discouraged that practice for now. And why I say for now is because a lot of this information right now is still being determined. There hasn't been real valid proof to be able to say that this is actually what should be the case in terms of if you run out of tests. But the WHO did stand up and provide China with additional tests so that they can be able to better monitor and better provide the negative or positive information that they've been receiving after conducting these tests with potentially infected individuals. If you notice, now we've kind of seen the line somewhat plateauing. We don't want to say that it has plateaued just yet because we are still seeing a number of infected cases being presented from China, but we are seeing that number significantly drop as opposed to what it was several weeks, several days ago. And we hope that the trend would continue for it to allow for a downward spiral so that we can see the cases start to cease from the People's Republic, who have been engaging with the coronavirus since as early as December of last year. The green line in particular shows that we have seen a steady rise in people recovering, and I think that that's a great data point for us to share. Reason being, with more people recovering, that kind of shows that there is a spectrum associated with this case. We do have people who oftentimes may present with, and I'll get into the numbers after this slide, but will oftentimes present with mild symptoms, and then we have another group of people that might present with moderate, and then others that have more severe or critical cases. The case fatality rate seems to be somewhere around 3-4%, very similar to what we've seen with other pandemic flu cases and with the Spanish flu, as well as with the Asian flu, which occurred in 1957. These are pretty solidified information that we've been able to gather, and we're hoping that we can keep that down through a lot of the efforts being employed by a lot of countries out there. What's been a concern for us in particular is seeing that we've started to see a slow rise in cases from China. We've seen a huge uptick in cases outside of China, in particular that yellow line. We are still getting more information about countries that are experiencing a lot of their first infections. We ourselves are continuing to maintain efforts that I'll speak about shortly to be able to make sure that we can better protect ourselves and mitigate a lot of the concerns that are arising in our community associated with COVID-19. This was the data that I wanted to speak about in particular. A lot of this was taken from the Journal of American Medical Association, otherwise known as JAMA. JAMA has been a world-renowned journal that provides for case studies in particular, and they're peer-reviewed, peer-edited, and they do come out with a lot of findings and recommendations. In particular, with this information, it was provided by doctors and subject matter experts from the Chinese Centers for Disease Control and Prevention, where they looked at 72,314 cases, and that was spread through confirmed, suspected, diagnosed, and asymptomatic individuals. What they came out with was a pretty good solidified number that has been pretty consistent throughout what a number of people worldwide, to include even the National Institute of Health and CDC, have been observing. In particular, a lot of the concerns right now in our community should be towards comorbidities, individuals who have either chemo treatments, who are diabetic and seeking hemodialysis, or might have other health conditions associated with their person. In particular, any chronic respiratory disease, hypertension, or anything related to cardiovascular health, as well as cancer, chemotherapy, as well as hemo. We've been observing that a number of the case fatalities associated with the COVID-19 have been particularly within the age range of people 60 and above, and individuals who have underlying health conditions when they present at a hospital. Some of the information that I wanted to share with you guys as well is some of the efforts that CNMI has done to be able to mitigate a lot of what's happening out there with the COVID-19. Specifically, we've been able to implement through the assistance of not only CEO Munya, and Director Warren Villagomez, but also through the Governor's Office and other governmental partners, a CNMI Health Declaration Form. If you may notice, this declaration form is very similar to what we have in a customs declaration form. The back also provides some frequently asked questions that we can kind of provide in terms of answering a number of concerns that people may have with filling this form, and also ask some of the questions associated with some recent travel or whether or not you've had any recent contacts who have been sick. This form then is provided to health screeners upon entering the CNMI prior to deplaning. We go through the forms, we make sure that we look for anything of concern in particular, and then from there we work with the airlines to be able to provide these forms back to individuals on the plane who may be required to seek further guidance or further questioning from our health screeners. And what we're doing here is not because we want to delay anything or we want to pinpoint people exactly for this disease. What we're doing is trying to protect the health and welfare of the community as well as of the person himself, so that he may not go out and transmit this to his family, to his friends, or engage other people in the community who may also carry the disease. Some of the information that we've shared in particular has been, and we didn't change that out initially, we had the passenger screening flow. But now what we've incorporated, and I wanted to share with you guys, is what if an individual was to present over at the ER? We have an individual with infectious illness providing some kind of symptom, maybe cough, sneeze, fever as well. What's going to happen when this individual shows up at the CHCC hospital? What we've done and effective today is that we've had pre-health screeners located at certain entrance points of the hospital. These health screeners are going to be able to look at individuals, speak with them, get a little bit more information as to where their whereabouts, whether they're a visitor visiting a sick family member or an individual who's seeking care, and going to be able to provide them with the necessary information to move forward. Some of the information that they provide to us may also determine that this individual who's seeking care might present with symptoms that might be of concern. We have been speaking with our teams. These people will be identified and brought to our isolation rooms, both located within the ER as well as our family care clinic. And these people will be seen by an ER nurse or an FCC nurse to be able to get vital signs and more statistics that would better inform a doctor prior to a doctor coming in and being able to engage a patient. This information is something that we have been sharing with a lot of our internal colleagues, and we are able to share this information with anyone else who may have questions after. So please feel free to let us know and we can provide that as necessary. Some of the efforts I wanted to make sure that we did touch on is how do you protect yourself? What can be the best thing that you do? As we've come to understand with this virus in particular, is it acts very similar to the common flu. Last year in the CNMI, we lost 7 individuals to the common flu. In the same time period, flu season within the US and its territories, we had 19 million people who tested positive for the common flu. Of that 19 million people, we had 10,000 people succumb to the common flu. And of those people, we had 68 of those that were children. That is a concern for us right now. And we want to make sure that in the event that we do find somebody here who does present with these symptoms and there is a concern, we want to make sure that you are prepped, you are ready, and you are able to better engage as necessary. One of the biggest steps, and I know it may sound very simple to a lot of people, is wash your hands. Take that 20 seconds to be able to wash your hands with bar soap. It might be it might be very elementary for a lot of people, but a lot of people don't do this. And that is actually the most effective way to be able to prevent you being able to capture an illness or being able to transmit an illness to somebody. Another effort that we want to also make sure that you guys are aware of is knowing how to properly cough, whether it be into a tissue or into your elbow. It's very common in human nature for us to immediately reach to our face with our hands to be able to block a sneeze or a cough. And what ultimately may happen is you block a sneeze and a cough, you're not being able to engage another individual. Or if you shake another individual's hand, you may ultimately be passing on the illness or the virus, be it either coronavirus, be it the flu, or another infectious disease. And not necessarily by shaking hands. What we want to make sure you guys are aware of is that coronavirus is spread through droplets, meaning when you cough, when you sneeze, when you talk, when you eat. These are all methods of transmission that are happening right now and a lot of people aren't aware of. Is that we as human beings get so commonly touching our face that in the event that we don't catch it, we oftentimes start touching places that are points of entry, be it your mouth, your nose, or even your eyes. These are all entry points for a coronavirus. And it is what we call it's a codependent virus, meaning that it attaches to a cell, takes over that cell, and then starts replicating itself within your body, and then transfers on to another host. So it really is our practices and being able to make sure we reinforce a lot of our proper hygienic tools to be able to combat the transmission of the coronavirus and ensure that we protect our community further. We've been pushing out a lot with the flu campaign. A lot of what we've been doing with infectious disease doesn't only start with the coronavirus. Our office, in particular under CHCC, through the direction of Director Warren Villagomez, has been on the infectious disease battle for several years now. As far back as Zika in 2015, moving forward with Ebola, also looking at other areas such as dengue, which was predominant throughout last year in Guam and other areas, as well as even the measles, which became prevalent towards November, December in areas such as American Samoa and Western Samoa, and spread throughout other areas as well. So we do encourage people that if you do have time, engage with the immunization program out of CHCC, come in, get your vaccines, make sure that you continue to maintain your health, get enough rest, and be able to share a lot of the information we provided with you today, down to your family members, down to friends, down to your colleagues, so that we can all practice healthy measures to be able to stay coronavirus and flu virus free. Some of the questions and answers that I wanted to provide with you are some of the things that we've picked up throughout a number of our presentations. A lot of questions that we can help you with in terms of what we have here. We are also able to take questions after if need be, depending again on whether there is time allowability for us to be able to better engage. What do I do if someone next to me has flu-like symptoms? The number one thing that you can do is what right now has not necessarily been recommended from CDC, but is something that they are alluding to in the event that it does become a widespread concern, is social distancing. Right now, CDC is preaching that 6 feet, usually when you engage an individual 6 feet with somebody who does present with infectious symptoms, is what's the recommended distance. In addition to that, if you know somebody is sick, advise them that perhaps they can stay home. If you have somebody in your family that you're caring for, we will, by all means, make sure that you do, if they do present with flu-like symptoms and whatnot, they're able to wear a mask. We don't recommend masks for everybody in the community. CDC has also come out and said that masks, in particular surgical masks, are effective for people who are sick in them being able to not transmit the virus out. But for people who are healthy and who do go about the community, there is no need for you guys to be able to wear masks. Reason being, these masks already have entry points within themselves, especially if they're the masks that you put behind your ears, the elastics behind your ears, or the ones that you tie up. Those still have entry points in which a virus can potentially still enter, whether it be through your mouth or your nose. So, and then of course with N95 masks, they're only recommended for people who are taking care of family members who are sick or people in a healthcare setting. That's what we would hope people would allow for the prioritization of these N95 masks, because I know they're very limited right now, island and globally, to be able to make sure that they're going to be with the people who are going to be taking care of these patients who do present with COVID-19 or similar symptoms as well. Is there a vaccine right now for 2019 and COVID-19? At this moment, there are no vaccines. We do have regular talks with CDC and WHO daily. Our leadership also has the same talks as well with a lot of the CDC and WHO leadership regarding these. In the US in particular, the National Institute of Health has begun to suspend certain rules in reference to being able to better test and come up with solutions, vaccines that will be able to address a number of the COVID-19 concerns. Right now, there is no vaccine. In quoting a lot of what Director Anthony Fauci, who is the National Institute of Health's Division of Allergic and Infectious Disease, he has come out and said we're about 2-3 months away from being able to see a vaccine. And even from that, about another year away from being able to have something that can be mass produced and provided to the population. So a lot of our efforts at CHCC and worldwide with a lot of healthcare settings is mitigation, being able to slow down the spread of this disease so that we can be able to see an uptick in research and technology that will better address this at the moment. What are the treatments available? So right now, the number one thing that I'm engaging a lot of our healthcare facilities and speaking with our doctors, our Chief Medical Officer, John Tadella, as well as Dr. Beth Conan, who's our Deputy Chief Medical Officer, is a lot of the support that can be provided right now at CHCC and other healthcare settings relative to the COVID-19 is palliative care. In other words, supportive care. If you come in with a cough, we can help you treat the cough. You come in with a fever, we can help you reduce the fever. But there is no one-size-fits-all solution right now for COVID-19. And it is because of this that we are really preaching the preventative measures, being able to make sure that we practice the hygienic steps and tools and pass them on to our family members so that we can all be able to mitigate a lot of the concern. Is there monitoring being done at the Commonwealth Seaport? That's been a question that we've been asked on different fronts. As of right now, yes, there is. For people familiar with some of the processes for a vessel entering the CNMI, it's required that they report 96 hours prior to their entry into CNMI waters to U.S. Coast Guard. We are linked directly with U.S. Coast Guard in being able to identify passengers and vessels that are entering the CNMI, and whether they do have an individual who is sick on board, they are required to go through certain standards. If I'm not mistaken, they raise the yellow flag, and then from there, our public health team is usually at the port prior to their entry so that we can be able to board and better assess and determine whether it's an individual who requires additional care or whether this person has recovered fully. And we do have people who are trained to be able to make these determinations. And if it is something that they do not encounter, we also do have a doctor, a physician on the spot that can always provide us with the necessary steps so that they can also make an informed decision. What was the low priority case at CHCC? That CHCC issued a statement for. For a lot of you that are aware, several weeks ago, we encountered a patient who presented at our ER or at our family care clinic who had flu-like symptoms, and there was a lot of concern regarding this case because the individual had a lot of issues in trying to provide us with answers, the case investigation teams. He wasn't forthcoming with a lot of information we were requesting of him. And because of that barrier in being able to get information, we felt it in our best interest, out of an abundance of caution, to be able to issue out a testing request to CDC in Atlanta. After going through discussions with CDC, they came out and determined that it was a low priority test because this individual did not meet a lot of what is considered the case definitions at the time for a novel coronavirus case. Being that we did send it out, we did notice a lot of gaps within our processes that we've been able to address. And moving forward, knowing now that Hawaii has the same capability, we are looking at being able to expedite processing of individuals who are patients under investigation, requiring the testing. And we're looking to get that now. What used to consider 5 to 7 to 9 days is now going to be shortened up to 3 to 5 and possibly even 2 to 3 within a short period of time. We do have a lot of these moving parts at CHCC. In addition to being able to do that test, we are building up our laboratory capacity so that eventually, once we get all the equipment and personnel and training in place, these people would also be able to test for coronavirus as well at CHCC. What triggers or thresholds can be identified to signal a campus closure? I think that was a question that we had a lot going on, and we have actually been, when we got this question, we reached out to the former CNMI territorial epidemiologist, Dr. Paul White. Dr. Paul White is a Pacific-wide renowned epidemiologist who has worked for the WHO, and I believe right now is in contract with WHO based out of the Philippines to be able to monitor and assess a lot of things happening with the COVID-19. There's a lot of factors that come into play. And basically what I'm trying to say is that there's no one solution. There is not necessarily a trigger in place in terms of identifying one case and from there we're going to consider it a school closure. There's going to be a lot of factors that are going to come into play. Method of transmission, who the individual has come in contact with, and whether this individual has engaged any other areas outside of the campus setting to be able to determine whether or not it would be in the best interest of the campus to be able to provide for closure. Right now, it is a very fluid situation. A lot of these things are going to be game time decisions that are going to need to be required. And it's going to be, of course, a whole community effort, meaning that in the event CNMC sees a required need for this type of closure, it will be something that will be engaged with through the leadership of NMC, Of course, our public health leadership, in addition to our governmental leadership, to make sure that if we do come to that decision of closure for the campus, it is made with all the right factors in mind, and always making sure that we prioritize this health and safety of not only the students, but the faculty as well. What should I do regarding COVID-19? So in particular, I wanted to kind of touch base on this and see if I can be able to hit a number of areas that would be able to be addressed, or something that can be further looked at from all aspects of the school. In particular for administrators, a lot of people who work in the offices, a lot of the leadership, faculty and staff, a lot of the leadership positions, look at your emergency plans. And if you don't have an emergency plan in place that addresses anything with infectious disease, it may be a good time to be able to see something that fits your size, scale, and scope, and then be able to adapt it for your setting so that it can be able to better address a number of things. And being able to have a plan in place means once you identify an individual, what are your next steps? Who are you going to notify? Who are you going to call? In the event that you call these individuals, what are you going to do to be able to maintain this person? We did speak a lot about being able to identify an isolation zone. Doesn't necessarily mean it has to be a classroom. It can be an open air setting, given that none of the rooms here, to my understanding, are negative pressure, which is usually recommended for closed door settings for a person with infectious disease. Find an outside pala or something to that effect, where you can have the person stay there, be able to get the necessary care from DFEMS or notify DFEMS so that they're aware they're going to be engaging an infectious person, so they can come prepared as well, putting on personal protective equipment, things to that effect, so that everybody who's going to be through the process is also protected. Faculty, what is something that the faculty can do is definitely monitor your students, determine whether or not you have individuals who are presenting with infectious illness symptoms. If you see cough or anything like that, advise them that maybe they can head home. If you yourself are a faculty member who may be sick, stay home. Advise the necessary people that you won't be in. If you need to give further on readings or anything to that extent for these students to be able to get more information while you're recovering, that might be also another process. Another thing that I think is awesome is what we spoke about earlier regarding the opportunity and availability of being able to do certain courses online, doing somewhat of a virtual instruction. I think that is going to be a good step moving forward, at least to be able to see to what extent you can still maintain class progress without compromising anything with class schedules. Additionally, for facilities, people who come in and clean, you want to make sure that you always disinfect certain areas, general use areas, bathrooms, doorknobs, certain classes where you've had people or something to that extent coming in with symptoms or coughs or things like that. It might be good for your teachers to be able, your faculty to be able to come in and engage your cleaners in the event that they need, so that the cleaner, after they're done cleaning a certain area, can also come into that room and just do very basic sterilization. At the point right now, it's recommended that for every gallon of water, about 5 to 10%, 5 to 10% is bleach. So if you have Clorox, you can go ahead and mix that in, and then for every gallon of water is about, I would say, about a half a cup to a whole cup of bleach. And that's a very effective disinfectant at home. If you guys don't have soap or anything on hand, hand sanitizers, hand sanitation liquid is also something that is very effective at the moment for viruses. A lot of people, they get confused between a virus and bacteria. Bacteria, you can use antibiotics. Viruses, you can't. So that's something that also making sure that people understand the nature of the beast in particular. This is something that we are all engaging for, at least for myself, on a very first time. I cannot remember the last time where I've been this involved in a response activity for something invisible. In my prior life, I used to work with emergency management for the CNMI, and I'm used to being able to see the typhoon, know the kind of monster we're going to deal with, and see what ways we can mitigate from this monster. What we're doing right now is we're dealing with microbes, and when we deal with microbes, it's an invisible monster for us. So, there's a lot of information that we're gathering as the days and weeks have gone on. We're getting a lot of guidance from CDC and WHO regarding a lot of the methods and procedures, that best practices that they've identified. And as time goes on, we're going to be adjusting our response to better fit the need of not only our community, but based on the guidance we've been receiving from agencies out at CDC as well as WHO. And for students, lastly, cannot forget the students. If you are sick, please engage your teacher, your professor. let them know, your instructor, that you're not going to be able to make it because of illness. Stay home, make sure you take care of yourself. Your immunity, your immune system is very critical during this time, most especially knowing we're dealing with a virus that behaves very similarly to the common flu. So making sure you get enough rest, you get enough liquids in, making sure that you properly diet, you properly hydrate, you eat properly. These are things that are going to be very good for you in the long run to be able to move on from being able to contract this virus. So I believe at this point we're okay. If there are anything in particular, ma'am, we can address.
Well, I did have a question.
Yes.
You did mention that one of the best ways to really avoid and to protect against contracting any virus is really to wash your hands, right?
Yes.
Soap and water. Now, in the classroom setting, we don't have water available and soap. So you talked about hand sanitizers and really having our cleaners come in and sanitizing the whole area. How much time between each time that we would need to sanitize the classrooms? Because some classrooms host as many as 3, 4, 5 classes, different classes in the day.
So for us, if I may recommend, we also have gotten the same question from our admin staff at the hospital, knowing they deal with sick people coming in to seek care. They've asked how often should they be sanitizing and wiping their desks or anything like that. And what we've told them is that it really is going to be a decision based on certain factors. More in particular is whether you have somebody in the classroom who has presented with symptoms, cough, sneeze, maybe the cold or the flu. That would be also something that potentially would require engagement from an instructor to maybe the admin, and then from there for them to coordinate with our cleaners to be able to come in. And usually, as we've seen it at the hospital, I can speak on what we've seen at the hospital, is usually about 2 times or twice a day. Usually they come in, they do the necessary cleaning, and then they come in again right after lunch to be able to do the additional cleaning as necessary. But I would recommend anywhere between 2-3 times at the most, and that's of course again engaging a faculty member and determining whether or not there's a requirement based on the symptoms or an individual presenting within a classroom with certain symptoms.
So we have the chat feature open.
Yes.
And so folks have been submitting questions. If it's okay for me to read some of those questions to you.
Not a problem.
Okay. I'm going to need your help, Dennis. It looks like I scrolled all the way to the bottom. I'm not sure if I'm at the beginning or at the end. This one? Okay. So the first question I have here is, will the CHCC receive testing tools for COVID-19, given that there may be a shortage in the US? Does the CHCC have a quarantine procedure for suspected or confirmed cases? And I think you addressed that early on in your presentation, but going back to the testing tools.
Yes, so we are right now in the negotiating phase with CDC to be able to acquire those tests. The only thing that is our biggest hindrance right now is making sure that we have the proper equipment within our laboratory to be able to test. And right now we have procured the equipment. We are in negotiations with a vendor to be able to ship the equipment in and trying to see what are the fastest methods we can do that by, that is also still within our budgetary allowances. But we do have full support from the leadership. Our chief financial officer is very much on top of this to make sure that whatever needs to happen, we do have the funding available. And once we do get the equipment, get it calibrated, and we do have necessary training on the equipment, we are going to make sure that we do begin testing immediately. But right now, we are also looking at contingencies outside of CNMI being able to receive testing equipment and test for coronavirus. We have engaged with discussions with Guam Public Health to determine if they get it before us, we are going to be able to negotiate with them to be able to run these tests. And if need be, Hawaii has pledged their support to run any tests that the CNMI looks to send towards their way. So we do have contingencies in place right now. And once we do get the equipment, our primary methods will be considered our secondary, and we would be identifying that as our biggest accomplishment. One of the biggest accomplishments to date is being able to make sure we test for corona. And we will also be informing the public once this is happening. So if there's one thing I just want to stress is that a lot of people have been concerned about whether, and this is me trying to address some of the rumors, there's been a lot of concerns about whether somebody presents at the hospital or the clinics and they find certain symptoms or anything like that. And a lot of people, on what I've seen or heard from social media, is that these people are saying that CNMI has coronavirus. to our knowledge to date, nobody has coronavirus in the CNMI. And if somebody was to have a confirmed case, or if there is anything to that magnitude, we at Public Health and CHCC Hospital are not going to hold that information. We are, our priority is to take care of the health of the people here in the CNMI. We'll call the CNMI home. And we don't feel that the information being with us is going to be of any good use unless we get it out to you, the community, to be able to make properly informed decisions.
I think the other part to the question was also in regards to the ports of entry.
Yes.
There was a question in regards to taking temperatures of passengers.
Yes.
And then the other one is parcels and packages received from China. Are those being sanitized? If you
So-
know of any process in
Okay,
place.
so I can address to my knowledge what we're doing right now at the airport, and then I'll also address the packages as I understand it right now. So as right now with our procedure, do you want to go over some of the stuff on our airport protocol?
Sure. So we did get guidance from CDC Honolulu Quarantine Station. We are in direct communication with her, and we did get a flow chart. So what they recommended was we do primary screening, which includes visually observing passengers coming in from the airport. And as soon as we identify someone who is coughing, sneezing, fever, again, the only time we pull people aside to check temperatures are people that presented with symptoms. That is when we consider that a secondary screening, where we have our health inspectors ask a few questions where the person has traveled to, have been in contact with any sick individuals. And then if we believe that this could potentially be a corona case or a person under investigation, we refer that person to a tertiary screening where we refer them to ARF. ARF comes in, does their assessment. They confirm our findings. That person will most likely be transported to the hospital where they would do an in-depth screening on that passenger.
And then to address some stuff with the packages from China, we've been seeing a lot of different information regarding the lifespan of the coronavirus, depending again on the packaging and the surface that it stays on. As we understand it right now, metals are about 2 to 3 hours. It might be longer, up to 96 hours. And then from one of the studies that have come out, we've seen even where it says up to 9 days. In terms of packages, maybe receiving, if I understand it, from the postal or the mail, there are screening criteria that are being done also by postal inspectors regarding a number of packages, and I believe there are sterilization methods also in place to be able to receive packages and things like that. We've also got questions about whether containers or shipments are being accepted in the CNMI from China, and what we wanted to reiterate with the community and with the NMC as well is that there is no limitations from the CNMI side in regards to containers coming in from China. The hold up with a lot of those containers is that because of the containment methods employed by the People's Republic of China, a lot of the people who usually work at these ports, who load the containers onto these ships to come in, are right now quarantined at home. So these people are not able to work until they've cleared a certain threshold of, I believe, 14 days right now. And because of that, we've seen a delayed entry of containers coming in from China in particular, but there is no hope from any commodities or goods coming in at the moment. And even for those commodities and goods, they have to meet certain regulations from the FDA, US Department of Agriculture, and all of those checks are in place, multi-layered response.
Another question here is that, well, you've stated that there are no cases in the CNMI. Are we saying that there are no cases because we have not tested, and we have not tested because we don't have the testing tools?
No, we're saying that there's no cases. Well, I can say yes and no. Yes, we have not seen any cases that have been here in the CNMI. Reason being that we have a certain clinical management piece where our doctors are going to be looking at a patient, determining whether or not this patient meets a certain criteria for the flu, and then we're going to test for the flu, whether or not it's a common flu. Now, if a person comes back and this individual comes back with a negative test but still presents flu-like symptoms, that is where we start exploring, and that's where our doctors, our physicians start looking at other reasons why this person could be presenting with flu-like symptoms but doesn't have flu. It could be viral pneumonia, it could be another ailment, it could be something that we need to further discuss. And again, I'm not a doctor, but as I understand it, there are certain testings that are done that provide information regarding an individual. and they're using that information to make a determination of whether or not we send it to CDC or not. And right now in the CNMI, as I understand it, our required threshold to determine whether or not we engage CDC is very minimal, meaning that if we feel in our heart, even if tests say that it's going a certain way, we do send packages off, and we will send packages off.
Looks like he's got the questions up on the screen.
No, actually, that's the question that she just asked.
Right.
Yeah.
So how do I go to the next question? Over there now. That's all right. Next one is, when was the health declaration form implemented?
The health declaration form was implemented, if I'm not mistaken, February 12th. And it's something that we are using right now. The health declaration form was implemented in response to the governor's public health declaration of an emergency. That has enabled CHCC in particular to make sure that we employ certain methods and procedures that would help us be able to determine who entering the CNMI requires further screening, or whether this individual is not of harm to themselves or to the families or anybody in the CNMI. Our hope is that we can make this something ongoing. There is discussions about that right now with the governor's office, with the MVA in particular, discussing how we can make this part of the requirement. Some countries right now do implement this same method. The Republic of Palau, for example, does implement a similar measure where they require people to fill out a health declaration form in addition to a customs form prior to entering their waters, prior to entering their land. So we're hoping that we can employ this similar method, and that moving forward, it would be something that can be utilized beyond just the current public health emergency declaration.
One more question. You presented the confirmed cases and the recovered cases. You also presented the overall infections, right? That was determined. But what defines recovery with the number of individuals that recovered from the virus?
So as we understand it now, and that's actually a very good question, because it was the first one that I asked when we started getting data about recovery. What thresholds are determined for recovery? As I understand it right now, they're using a very similar method as what they see with the flu. No signs, no symptoms in particular. I'm in discussing this with a virologist from CDC, as we understand it, is that when a person is considered recovered, they've already built up a certain immunity to the virus itself, meaning that these people, the opportunity for reinfection it's almost not occurring. So we also have seen information regarding people who may have tested positive first and then negative and then came back to positive. A lot of what we've been seeing out there is that there's concerns regarding the sensitivity of their testing, meaning that there might not be the same sensitivity threshold in the tests that are being administered to this individual. So it may be possible that they do come back negative on one test, and then several days later they present at the hospital, meaning that, and then they come back positive, meaning that they were never really coronavirus free. So there is a stringent requirement for them to be considered recovered. And as I understand it too, even after they've been identified as recovered, there is still follow-ups that are done with these individuals. And on a case-by-case basis, people like Doris and myself do go out and actually visit people at their homes to make sure that there isn't any underlying health issues associated with them being deemed as recovered.
Thank you. Are people with a history of asthma at a higher risk of succumbing to the virus? What can they do more to prevent themselves from contracting the virus other than what has been presented?
People with asthma, it is identified as a concern, a potential concern being that a lot of people who have been succumbing to the illness have done so through what's called ARDS, acute respiratory distress syndrome. And this is basically like when your lungs, they become so dilated, they become so, what would be the word for it? Infused with liquid and then unable to be able to properly saturate your blood, your blood oxygen levels, that it leads to respiratory failure, it leads to organ failure, and things to that effect. If you do have asthma and it is a concern for you, the number one thing that we can advise you from a prevention standpoint is to please, by all means, continue to practice those steps of washing your hands, staying away from sick people. If it is somebody who you encounter a family member that you're providing care for, please look at being able to use proper protective equipment, such as maybe a surgical glove as well as an N95 mask. And we only advise this for people who are coming in direct contact with family members who they're providing care for, or if you work within a hospital facility or healthcare setting.
Okay. I know you mentioned earlier about the health declaration form. Is this form given to everyone?
Yes.
Because the question here is those traveling into the CNMI aren't being screened if they aren't showing symptoms.
So that is what we have, to be able to address that, we have done two things. In particular, the health declaration form is able to let us, enable us to better identify individuals who may have come through countries. And as you know, a lot of them have been coming from areas of concern right now. But it also allows us to be able to do what is called contact tracing. And you want to speak more about it? So in contact tracing, what we end up doing is we identify the individual. Once we've been able to question the individual, we start going out and looking at all possible contacts, even the individual at the store, maybe they went to church. We've had to do this on several occasions with other illnesses as well. So us being able to engage these people and get a better scope of what the required containment is going to be is something that we use this health declaration form for. And it is something,
And the health declaration forms can assist us by, it indicates the passenger's seat number. So we know the people that were sitting around that passenger would need to be followed up. We need to do contact tracing for each and every individual that was either 3 seats away or 4 seats tapped, front and back. And then it also has the passenger's hotel contact number. So if our team needs to go out, that form would assist us in following up with that individual.
Okay.
and then if I may address so yes, there is a possibility that an individual may not present with symptoms and still enter the CNMI. And what we've done, actually, one of the measures we've employed is in particular at the healthcare facility at the hospital. We do have people effective this afternoon who are going to be manning certain stations at the hospital, certain entry points, and are going to be also able to identify certain individuals coming in and better assess what their required purpose is at the hospital, whether it be for them to seek care or to visit a family member. In addition to that, we've also started minimizing certain entry points for the hospital as well. For example, the dental clinic, usually it has its own separate entryway. We have closed that off effective this afternoon. And now people that are going to be requiring to go see their dentist for an appointment or go in to check with immunization will be required to go through the gift shop side, which is also going to be manned by individuals who are going to be looking and assessing whether or not there's going to need to be additional screenings.
Okay. All right. Last question, just real quick. Yes. How long does a mild case last?
It varies. Again, there's a lot of factors that come into the play when you talk about the length of a person who may be suffering from certain signs and symptoms. Age is definitely one of them. Immunity is another thing. Whether or not this person has been around other sick contacts or whether or not this person is in environmental factors as well come into play. So we've seen it where kids, in particular, what we're trying to understand from our end is how we've seen such a low level of infections with kids. Being that we would think there would be one of the more susceptible populations. We definitely know that they can spread the virus as they do very commonly with the flu and other ailments, but they have not been, they've actually had minor symptoms, and then in addition to that, they've also recovered a lot quicker than a lot of the older individuals that have been identified with the coronavirus.
Okay, well that's it as far as questions are concerned, and thank you very much.
No problem.
For your presentation. It's great timing. It's exactly 12:59.
Well, if there's any other questions or concerns, you can always reach us out at the hospital, 234-8950, PHEP, FEP. That's our program. And if there is something in particular that is lingering, you can always give us a call. And if it's something, like I said earlier, we don't have the answer to, we will further go out and get the answers for you from a lot of the SMEs that we have been.
And PHEP is Public Health Emergency Preparedness.
Yes.
All right, you heard that, folks. Well, thank you.
Thank you, guys. Hey, my neighbor.
Thank you. Thank you so much. That was a great presentation. Are we
I got nervous
done already?
My head was at the back of the room. You should get up.